Hey everyone, Dr. Shahid here, and in this video, we're going to cover everything you need to know about bleaching for your dental board exam. Let's get into it. So we're first going to briefly go over the different reasons we can get a discolored tooth in the first place, because really, when we talk about tooth discoloration, it's a bit like solving a mystery with clues both on the surface of the tooth and hidden inside the tooth that helps us identify the culprit. We're first going to focus on intrinsic factors that are localized to just one tooth. And guys, intrinsic in this case just means we're talking about factors that have to do with the tooth itself. Alright, we'll begin our discussion with pulp necrosis, one of the most common causes of tooth discoloration. And what's really happening here is that the byproducts of tissue breakdown seep into the tooth's tubules, staining it from the inside out. Then there's intrapulpal hemorrhage. Think of this as an internal bruise, leaving its mark on the tooth. Caries too can play a part in this. It contributes to the discoloration as it progresses and damages the tooth. We can also have calcific metamorphosis. This is the third time I've now mentioned this condition, so I expect all of you guys to know exactly what it is. But it essentially is a yellow tooth due to the formation of tertiary dentin, sort of like a tooth's response to injury by building a protective layer. Root resorption is another factor which we also discuss at great lengths in this video series. And let's not forget about the effects of endodontic treatment itself. We have remnants of pulp tissue, intracanal medication, like the triple antibiotic paste used in regenerative procedures, and plain old obturation materials. Think zinc oxide eugenol, plastics, or metals from sealers. So endodontic treatment itself can leave its mark, changing the tooth's color in various ways. So each of these factors, guys, contributes to the unique story of a tooth's color, painting a picture of its history and health. Now let's turn our focus to some intrinsic factors that have a more generalized origin. First, there's just getting older. Teeth tend to darken or yellow as we age. Fluorosis is another one. If you get too much fluoride while your teeth are forming, it can leave them looking mottled, sometimes even brownish, especially in areas with a lot of natural fluoride. Then there are certain medications like tetracycline that can cause discolorations. If you take them when your teeth are still coming in, it can bind to the calcium in your teeth and leave stains. We can also have conditions that affect how teeth form, like amelogenesis imperfecta. These defects in formation can also change the color of teeth. And last but not least, certain blood disorders, congenital erythropoietic porphyria being one, can have a pretty noticeable effect on tooth color. Alright, now that we've covered both local and generalized intrinsic factors leading to tooth discoloration, let's take a look at some of the most common extrinsic culprits of discoloration. Most of these you guys will already be familiar with, and the first one is smoking. And I'll include chewing tobacco here as well. Tobacco in general can really stain your tooth. Then there's what you eat and drink. Foods and beverages, especially stuff like coffee, tea, or red wine, are notorious for leaving stains. Next, we have aging, and you may say, wait a minute, we just talked about aging being an intrinsic factor. And it is, but the thing is, as we get older, our teeth naturally start to yellow a bit, which is kind of a mix of both inside and outside changes, so I've included it here as well. And finally, let's not forget about chromogenic bacteria. These little guys can leave dark or orange colored stains on your teeth. Okay, so how do we actually treat these discolorations? Well, for teeth that are dead or non-vital, we can bleach the tooth from the inside. We call this internal bleaching or non-vital bleaching or intracoronal bleaching. All of them refer to the same thing. Non-vital bleaching is often the method of choice when we're dealing with a single discolored tooth that needs a pick-me-up. Now, there's a couple of internal bleaching techniques that can bring back that pearly white shine, and we're going to go over them. The thermocatalytic technique is the first one we will discuss, and it involves placing a potent oxidizing agent, like 30% hydrogen peroxide, aka superoxol, inside the tooth's chamber and then applying heat. However, it's a bit of a delicate process. Too much heat or chemical can irritate the tooth all the way to the cementum and periodontal ligament, potentially leading to external cervical root resorption. Definitely not something we want. Our next technique is the walking bleach method, which is actually the most commonly used technique for internal bleaching. Here, a mixture of sodium perborate and water is nestled into the tooth chamber. The patient then takes a dental walkabout for a few weeks, allowing the mixture to do its magic before checking back in. It's a less aggressive approach compared to its heat-driven cousin, and it's often preferred for its ease and effectiveness. Alright, so how about teeth that are vital? I mean, we can't really open up the chamber and use chemicals to whiten from the inside, so we have external bleaching techniques, otherwise known as vital bleaching or extracoronal bleaching. External bleaching is a real game changer in cosmetic dentistry because it gives us flexibility. We can brighten a single tooth or go for a full arch glow up. Our patients also have the choice of performing the bleaching in the dental office or at the comfort of their homes. For the in-office bleaching approach, we use hydrogen peroxide gels with a concentration of about 25 or 38%. It's a bit of a balancing act. Higher concentrations can yield quicker results, but they also bring a higher risk of soft tissue damage. To amp up the effectiveness, these gels are often paired with light activation using various light sources like UV, tungsten halogen, and even laser lights. These lights aren't just for show, they trigger the chemical reaction in the bleaching agent, making the process more efficient. But just with anything, guys, it's not all fun and games. Since in-office bleaching achieves a whiter smile in a short amount of time with the use of stronger chemical agents and light, there is a chance of affecting enamel hardness and introducing sensitivity. Alright, then there's the at-home approach, offering a more DIY route. We start by fabricating custom-made whitening trays for our patients to wear at night, and then we provide them with the bleaching agents, which are usually around 10% to 22% carbamide peroxide, which translates to about 4% to 7.5% hydrogen peroxide. So it's a much weaker agent. The success of this at-home treatment largely depends on how diligently the patient follows the routine. But since we're achieving the whitening results through a longer period of time with a weaker chemical agent, this process is kinder to the teeth and will result in less sensitivity. But to be honest, guys, even though tooth sensitivity is a common side effect of both in-office and at-home bleaching, it's usually just a mild and temporary side effect that resolves on its own. Okay, now we've talked a lot about these bleaching agents that we use, but let's review how they actually work. In the world of dental bleaching, hydrogen peroxide and carbamide peroxide are like the two main fuels for getting that sparkling smile. Hydrogen peroxide is a bit of a firecracker. It's unstable and breaks down quickly into water and reactive oxygen radicals as depicted by the chemical reaction. Because of this, it does most of its whitening work in a swift 30 to 60 minutes, which means it breaks down much faster than carbamide peroxide, which is more like a slow burning fuel. It's stable, takes time to react with water, and releases its active ingredients, hydrogen peroxide and urea, over a leisurely 2 to 6 hours, making its whitening effect last longer. And for every 30% of carbamide peroxide, we got about 10% of hydrogen peroxide in the mix. So again, guys, think of it like filling up your car with two different types of fuel for a drive home. Hydrogen peroxide is like a quick acting fuel that gets you there fast but burns out quickly. Carbamide peroxide, meanwhile, is like a fuel that takes you further on a single tank, perfect for those at-home bleaching journeys. Despite their differences in action, both these chemicals are equally effective in achieving that bright white smile that our patients are after. And a good way to remember which of these are used for at-home bleaching and which is used in the office is to look at the name. Carbamide peroxide starts with the word CAR, car. So think of carbamide peroxide as the material patients put in their car and drive home to use for at-home bleaching. And if you remember that, you'll know that hydrogen peroxide by default will be the one that we use in the dental office. Alright guys, that's it for this topic. Now let's reinforce everything we just learned with a couple of practice problems. Which is the most common consequence of bleaching non-vital teeth? Alright guys, pause the video if you need, and the answer is B, cervical resorption. And this is specific to the thermocatalytic technique because the strong agent, hydrogen peroxide, can enter the tubules and cause problems such as cervical resorption. Definitely not something we want. Alright, let's move on to the second question. Okay, we have an 18-year-old male with the following chief complaint: I don't like the color of my front tooth. Background on our patient history reveals previous trauma and root canal treatment, and current findings indicate discoloration of the upper left central incisor, which has been root canal treated. Okay, so the question reads, which is the most appropriate bleaching technique for this patient? Pause the video if you need, and the answer is A, walking bleach technique. So the walking bleach technique is the most commonly used technique for internal bleaching of non-vital teeth because it's safe due to the use of sodium perborate and water as opposed to hydrogen peroxide. Alright guys, that's it for this video. Thanks for watching. See you next time.